Hello students and welcome to MEDC 5344 Anesthesia and Intensive Care. So this short video serves as an introduction and a brief navigation for this clerkship. Now this clerkship structure, well only in San Fernando General Hospital, I tend to use a blended learning approach over the 4 weeks of the clerkship. And blended learning, as you may know, is a combination of online and classroom content. But it's just not content uploaded online. It's organized in a particular way and it's arranged in such a way to help you learn better. So you may have heard about blended learning, or you may even have experienced it in other clerkship, and to some students it may be a new concept. Okay, so what does blended learning does? Now, blended learning allows me to deliver more content to the students so we could focus in classroom settings on more discussions and higher order thinking or critical thinking. So it allows you as a student to develop a good problem solving attitude. Okay. A lot of the tools available in the online learning, for example, the discussions and the MCQs, also allow you to develop your critical thinking, especially the discussion boards and the platforms used there can also allow you to interact with your peers, get feedback from your peers, and helps you give you practice in discussing critical concepts which may be important to your vivas. Above all, the content and the use of multimedia makes it more uh, exciting for students. Now, a lot of people may have some questions about the assessments. I know that's a popular question. So how the module is structured, so coursework is 20%, and we also have a summative assessment, which is the last Friday of the rotation, and that is comprised of an MCQ, which is 40%, and a digital OSCE, which is 40%. Now, you may ask yourself, how do I navigate the blended learning components? Okay. Now, I highly recommend people that you access the blended content before my tutorials. It'll help you a lot. And all the content is provided on the Schoology platform, which is very simple to use, way more simple than my e-learning. And I've shared the code already with you all. So let's now go to the Schoology course, and I'll show you all how to navigate there. Okay, so welcome back students. So we're now in Schoology. So I've already logged into my Schoology account. So I am going to courses and I'm going to add the MEDC 5344. So when you add the course, this is the main course page that will come up here. So there's a lot of content in the course page. So, and it's all structured to go through them systematically. So you really need to go through them bit by bit. So the first thing you'll have here is a welcome video. So that is this welcome video I'll be recording now. And then we have a question section here. So if you have any questions for the course, just post your questions here. Somebody else might respond to the question, or I regularly check in, so I will try to respond as well. Now let's go back over to the main blended learning page. So we have a section here about what exactly is anesthesia and intensive care all about. I try to answer some commonly asked questions about the specialty. What is a typical day like? What about ICU? And I talk a little bit about careers in anesthesia and intensive care. Now let's go back over again to the main page. We have just an introductory discussion activity. What level of risk are you willing to take? So it's very interesting. I'd like to see your responses to that. So just post a response there and I will chime in after a while and we could take it further. So back on again to the main page. Now it's the course is the blended part, that is divided in sections. So the first one is preoperative assessment. The second one is intraoperative care and sedation. The third one is postoperative pain and the critically ill patient. And the fourth week we usually reserve for review and exams. Yeah. So let's click on the first folder. The first folder is preoperative assessment. So each section is very small, about 10 minutes. Some people could go through it faster. So let's click on one. What is a preoperative assessment? So I have some writing here on what exactly it is, and I have a quick video here that you all need to look at. Then we'll go back over to the main page here. And sorry, we went back too far. Let's go back in the preoperative folder. And another commonly asked scenario is a patient high risk. Let's talk about risk classification, a brief video, and we go back over to the folder for week 1. Now we also have sections on how fit you are, and we have a discussion activity. Now let's see how these clinical discussion activities are structured. So I have a case here, a patient with umbilical hernia, and now you're required to post first before seeing other people's responses. So I want you all to think, commit yourself to what you want to say, and post your responses there, right? So after you post, you will see everybody else's responses, and that will help you. You can learn a lot from your colleagues, your peers, and I will eventually chime in and respond to everybody. Yeah, so that's one of the examples of the discussion activities. So let's go back again to week 1. Then we have 2 big folders here on comorbidities. So again, everything is very clearly structured. So we have a little primer here that will take a couple minutes to read. Then let's look at the 4 comorbidities here. I have diabetes, high blood pressure, ischemic heart disease, and obesity. Let's look at, for example, if you want to look at high blood pressure, I have a discussion activity in a patient with a high BP. These activities are very important to go through and actually think it through, because they're going to help you a lot as you move through the clerkship. We talk a little bit about the pathophysiology, and all these things are going to come up again in the tutorial sessions. So if you have any questions, be sure to ask me there in the tutorial session. So let's go back again to that folder. So that is the comorbidity section. So let's go back over to the week 1 folder now, and blood tests. Blood tests and lab investigations are another big part here. So this is here, we have that section there as well. So we have 3 pages here, and I have 2 short PDFs that again is going to help you to navigate this section. Now let's go back over now to the main page. Now we finished off the week 1, and then we go on to week 2, which is intraoperative care and sedation. Again, more content here to systematically go through. And that's how it's structured. You will find discussion activities. Sometimes you might find MCQs, but it's all to help you in your learning throughout the course. Now, don't be alarmed if you can't get through the preoperative folder in the first week. It's there to be accessed throughout the clerkship. You should try to get it done in the first week, but feel free to go back, take notes, and you can keep going back all throughout the clerkship and learning as much as you could from it. So there's no real limit on it in terms of the time. But you will find I may not make week 2 available until the 2nd week, and likewise week 3 until the 3rd week, and so on, right? So if you all wanted to access it quicker, you just let me know and I'll do it. So that's it for this introduction. I look forward to seeing you all in the theaters, in the ICUs, and in our tutorial sessions.